congratulate Arogya City, Bangalore for holding this conclave. Honorable, dynamic, young Health Minister of Karnataka, Mr. Dinesh Gundurao, Her Highness, the Maharani of Mysore, Srimati Pramoda Devi Vadayar, the most active, energetic Additional Chief Secretary we ever had, Mr. Jairaj, Dr. Nalini Saligram, dynamic Revati Ashok, distinguished members of the Rotary, ladies and gentlemen. At the outset, I would like to thank you for inviting me to be here and share a few words. On a lighter note, I would also like to thank the organizers, I believe Mrs. Revati Ashok in particular, for holding this at Mount Carmel College. This used to be my favorite haunt many decades ago when I was actively wooing my wife who was a student here. And later on, a couple of decades ago, or maybe a little more, I was waiting out of Sister Albina's office every weekend to get admission for my daughters. So I'm glad that they invited me to be here as a speaker and not waiting outside the principal's office. Now coming back to the topic for today, just a few decades ago, if one had an illness more than a cold, cough or fever, you had to go to either Chennai, Vellore, Mumbai, or if you are wealthy, to the USA for any further care. And also, if some care had to be given in Bangalore, it was the custom to invite specialists from other parts of the world and the country to give this care. That was the kind of health state we had a few decades ago. So it's wonderful to see that we have come a long way since then with the advent of many state-of-the-art hospitals in Bangalore. It's good to see that the tables have turned and many people from other cities, other states and other countries now come to Bangalore for their healthcare. That's a very proud moment for all of us. And I must congratulate the government of Karnataka for being very proactive and encouraging the private sector to do this. Unfortunately, progress comes with its own problems. This transformation and development has come at the cost of unplanned development, stretched infrastructure, chaotic traffic and pollution. Though I am very proud of what Bangalore has achieved in the field of healthcare in the last few decades, our focus should truly be to create a healthy city and a healthy nation where the focus should be on creating wellness and not treating illness. We should strive hard and focus on primary preventive public health measures to keep people away from the hospital, even though we run a large hospital chain. And hospitals should be reserved only for emergencies, ICU care and procedures. My mantra for keeping the society and the city healthy is lifestyle modifications to keep non-communicable diseases at bay. Unfortunately, a developing country like ours has been burdened by both communicable diseases like COVID, the pandemic that we went through some time ago, dengue, TB, chikungunya, other respiratory illnesses, and also a huge burden of non-communicable diseases, which will be my focus of the talk today, which now has overtaken communicable diseases as the leading cause of mortality in our country. I am a very simple human being and I like to keep life very simple. I have some simple mantras for a healthy living, and that is controlling a few S's in your life. The first S is sugar and calories. You control your sugar and calories, you prevent obesity, you prevent diabetes, you prevent kidney disease. So from now on we go on a keto diet or diabetes reversal diet for people who have diabetes. Now sugar has become the new tobacco. I have listed it above tobacco. In my older talks I used to say tobacco is number one, but now it is sugar. The second is smoking, and tobacco in any form is poison. If possible, sir, please ban cigarettes from this country. I think that has done no good. It causes cancer, heart disease, peripheral vascular disease, strokes, any known disease that is a link to tobacco. Salt intake, we Indians are particularly very fond of salt. Salt in large amounts causes hypertension, heart failure, kidney failure, and all kinds of illnesses. So please avoid that. Sedentary lifestyle, which we are all used to now with Netflix and other OTT platforms. Everyone has become a couch potato. And I keep telling these couch potatoes, if you don't change your habits, please reserve a bed for yourself at Manipal Hospital. Because sooner or later you land there. Sleep, I think this is something that's not been given enough importance. I think a healthy, good 8 hours of sleep at night is very important for your health and well-being. If you don't sleep well, you're prone to numerous diseases, including heart attacks. One more thing that has not come out in the past and has been hidden is sadness or depression. I'm glad that many celebrities like Deepika have come out and spoken about depression because it's sort of hidden. People are sort of shy and stay away from saying I'm depressed. They think there's something wrong. Depression is another major cause of heart disease and other non-communicable diseases. So please, if you are depressed, talk to your friends, family, or any of the doctors or medical fraternity. The next S in my list is spirits. Now, a lot of patients ask me, doctor, all that is fine. How about small peg at night? Yeah. And as a doctor, I say we would never recommend alcohol. Though I think a small peg a day doesn't hurt you, but that's not what I would say. I would say stay away from spirits because one peg can lead to another and then it may be a health hazard. Another major thing that's been coming up in life these days is substance abuse. And that too, this is very common among the youngsters, and that's something that we as a society should address. Pollution, of course, is a well-known cause of heart disease and many other diseases, including lung diseases. One thing I see currently is the lack of social skills. I see a lot of families sitting for breakfast, and there are 4 people, father, mother, and 2 children. One child is watching the phone, the second child is watching the iPad, father is reading the newspaper, and mother is watching the TV. So they don't talk to each other while having breakfast. That is not on. I think we have to improve our social skills, and this is something where I think all of us should work together. And I'm glad a country like Australia is putting some restrictions on social media below the age of 16, which I think is something that we should seriously think of. Of course, there's a huge increase in the mental illness, and this has become more so after the COVID pandemic. And I'm glad that premier institution like NIMHANS is doing a lot of work in this. Now that I've talked to you about a few of the S's, there are 4 numbers in your life which you control very well. You don't need to see me at all as a doctor. You can see me at functions like this, but you don't need to come to me as a doctor. These numbers are sugar. If you're a diabetic, control your sugar. If you're a hypertensive, control your blood pressure. Control your lipids. And one more number I would like to add is your kidney number. Being a nephrologist, I'll be failing in my duty if I don't say kidney number. Kidney number is the creatinine, is a simple blood test which can estimate the function of your kidney. These 4 numbers that are under control would make sure you would live a very long, healthy and happy life. There is one kind of addiction that people don't know about, and this is called dopamine addiction. Not everyone may be familiar with the term dopamine addiction. Dopamine is a neurotransmitter chemical, also known as the pleasure chemical, released by specific areas of the brain. Many things that give us pleasure like sweets, chocolate, sex, social media indulgence, alcohol, drugs, watching TV, phone, iPad, release dopamine. And while dopamine is important for us to get motivated, there is a real risk of addiction too. Hence, we need to watch out and make sure we draw the line between motivation and addiction. And my line for this is very simple. If there's something that makes you do it, even when you know it's not good for you, or you're doing it in excess, then that means you're entering into the addiction area. Please stay away. We also need to be aware of the concept of digital detoxification. I think every weekend or at least few days or few nights in a week, stay away from TV, phone or whatever social media interactions that you have. I think it's good to have a detox of your digital devices at least sometime in the week. Let us all take a pledge today to work for an Arogya or a healthy city and nation by doing our bit of Alilu Seve, as they say in Kannada. We at Manipal hospitals pledge to take care of your kidney health through awareness programs, kidney health check camps at various locations, and we'll be happy to partner with the government, sir, with inputs from the Honorable Health Minister in programs for prevention and early detection of kidney disease in our citizens. Once again, I wish this conclave the very best. Thank you. God bless. Jai Hind.
Thank you, sir. Thank you so much. I think there is one line that all of you will have to remember. If you don't want illness, then concentrate on your wellness. That is a line, ladies and gentlemen, given by Dr. Sudarshan Ballal for us today. So could we have a huge round of applause for him, please?